Hello guys, welcome back to the PW Med channel. I'm Dr. Ranjit, your pathology faculty, and I'm going to discuss something which I feel is important and it should be addressed for the current generation. Whether be it an MBBS student, a NEET PG, FMG or an INACT aspirant, I am sure you must have been overloaded with information. I'm just going to talk about the importance of sticking to one source. I'm going to keep the rest away and only one source, right? So we're going to discuss about it, and I'm sure you will have lots of comments, lots of doubts. Please put down in the comments and let's definitely address those as well whenever it's concerned. So your generation especially is in an era of information abundance. You put anything on Google, anything, any new disease. Google gives millions and millions of search items in a second. You want anything, Google gives an answer. Everything is available at your fingertips. That is the best of your generation, and also I feel is a negative thing about the generation. We are not sure what to learn, what to retain and what to follow. Especially when it comes to an entrance preparation, what happens is, let's assume that you learn pathology from me. Your friend, he or she learns from some other teacher and says that, okay, I know this syndrome, it was taught in yesterday's class. And you're like, there's a FOMO. Will I miss it? Will I won't score enough mark? Will I have a negative marking? So you go and read that source as well. Then you tell to your student, okay, I've read with Dr. Ranjit and he told me about this. That student says, no, I don't know that. And she or he comes and listens to my lecture. This is a problem. And this is a problem which has to be taken care of at the early part of your preparation as well. Stick to one source. Like I said in the early, one source. Any source is okay with me. Any source which is going to help you to become a better doctor, that's the ultimate goal for all the teachers across the platforms. So go with a source which you are comfortable with. Let's say if you're comfortable with my way of teaching, stick to me. I am sure I will not be able to cover every question which comes in the exam. No teacher in this world can cover every question which comes in the exam. 100% strike rate is fake. So what happens is, almost every teacher will cover every important topics related to the exam. And definitely if you're able to remember them, revise them, retain them, you will definitely score very well in the exam. But the important thing here is stick to one source. Let's discuss the topic. Let's assume you might have known about Lynch syndrome for sure. HNPCC, right? It's a defect in methyl mismatch repair. It's a DNA repair defect. When do you think a DNA repair is important for an individual? When a cell is in resting phase or when a cell is in dividing phase? Obviously in dividing phase, right? Because when a cell divides, there's more chance of a DNA mutation, and obviously there is definitely a chance if the repair is defective, I can have a mutation. So now let's take two sides of a colon, right side and left side. The right side's colon function is absorption. The left side's colon's function is fecal compaction. So in right side colon, villi will be more prominent than the left side of colon. So can I say the right side of colon will have little bit more absorptive power, more villi, more regeneration and more cell division? Yes. So in other words, right side colon has a chance of having more DNA errors, so my mismatch repair is required. Let's take Lynch syndrome, where mismatch repair is defective. Is there a chance the same right side of colon, where I'm going to have more mutations, will end up having cancer? Obviously, right? That's a fact given to you. In Lynch syndrome, right side colonic cancer are seen. So this comes in MCQ. So my way of teaching is going to be conceptual to the core. I'll try to explain as much as possible every single fact put into you. So if you like the way of teaching, go ahead with that. That's all. It doesn't matter. Like I said, no teacher will be able to give you 100% of whatever comes in an exam. Right? So stick to one source. Going from one source to another, you might excel in pathology, but in exam it's not only about pathology, right? You have 19 subjects. You might want to aspire to become an orthopedician. If you read orthopedics for 2 months during exam prep, other subjects are going to be affected. So during the preparation phase, please stick to one source. Like I said in the beginning, I'm okay with any source. Every teacher who's in this platform, as well as in any platform who's teaching, is good and will be good. So please stick to a source which you like. Do not listen to extra informations, but whenever an exam comes, whenever a PYQ comes, please add on to that. That's the first thing. Second thing which I want to add here is, try to write your own notes. When you listen to my lectures, take a pen and paper, write along. Because I always believe the faintest ink is stronger than the strongest memory. You write it down, only when you understand it, you'll be able to write it down, right? So just two informations here. Please stick to one source, read it, revise it, that will make you stronger and more powerful. If I have to quote Bruce Lee, which most of you guys know, Bruce Lee said in an interview that I am not afraid about a person who knows 10,000 different kicks. But I'm afraid about a person who knew one kick and who has practiced this 10,000 times. Stick to one source, practice it more and more and more, revise it as much as possible, and I'm sure NEET or NEXT or INICT or FMG is going to be scared about you because you know that strong. So that's the only takeaway message here. Stick to a source, learn better, improve, and we all are going to become amazing doctors. The entire teacher profile and entire teachers of PWs, the only goal is to make you good doctors. You will become good diagnosticians. You will be able to treat patients very well. That's our main goal. And exam marks are byproduct of becoming a good doctor, right? So please stick to a source. I'm repeating it for the nth time, but I'm sure you will do that. And please start writing notes on your own rather than relying on someone else's, right? So thank you for your time. Thank you for patient listening. Like I said, if you have any comments, any suggestions to give us, please put down in the comment box. We'll definitely discuss more together. Fine. Thank you guys.